We're ready to resume, Mr. President.
Session is resumed.
Mr. President, with the permission of the Chamber, I move to resume consideration of Senate Bill 2865 under Committee Report number 49.
2865 or 2486? Any objection? Hearing none, motion is approved.
This is the measure on the Reproductive Health and Population Development Bill, Mr. President. The parliamentary status of the measure is that we're now in the period of interpellation. There were 5 other measures that were scheduled for interpellation before Senate Bill 2865. But as the majority leader, and just to prove that there are no dilatory tactics in the Senate, contrary to what our detractors say, we are taking it up earlier than the others. So we will we will dispose of this measure, Mr. President. Either we pass it or defeat it, or through the merits and not through dilatory tactics, Mr. President. So as long as I'm majority floor leader, we will tackle the measure at the earliest possible time that we should. May we ask that the sponsors be recognized, Senator Pia Cayetano and Senator Miriam Defensor Santiago, at the proper time. But at this point, may I ask that for the interpellation, there are a number of members of the Senate who have registered their intention to interpellate but are not ready for today, so I can take up the cudgels. So may I be allowed to start with the interpellations on the measure, Mr. President.
Please proceed. Who is going to defend? Senator Pia. Senators Pia, Cayetano, and Soto are recognized.
Yes. Mr. President, let me just reiterate the statement I made last week. First of all, Senator Miriam and I will both be defending this measure. I will primarily be answering questions on the socio-economic issues, while Senator Miriam will answer questions on theology and the law, although both of us will provide additional responses as required. I would also like to put on record that given that this bill is lengthy and covers a lot of issues, to allow the chamber to also to give the chamber sufficient time to discuss other measures, my co-sponsor and I have decided that we will be available to tackle this measure on Mondays and Tuesdays to free up the Senate time on Wednesday. And with that, Mr. President, we are ready for the interpellations. Thank you.
Thank you. Mr. President, I will be interpellating on the specific provisions of the bill. But first, kindly allow me to ask Senator Miriam Defensor Santiago if she will allow certain parts of her speech will the distinguished lady yield to a couple of clarifications on the statements she made in her speech, Mr. President.
With pleasure, Your Honor.
Thank you, Mr. President. The distinguished lady, in a certain part of her speech, particularly the statement, when does life begin? If I will quote her rightly, she said, when does life begin? Doctors and scientists do not know, and it will be presumptuous for legislators to settle this question by the expedient of parliamentary debate.
That's a fair quotation.
I believe so. Thank you very much. The distinguished lady is probably correct that doctors and scientists do not know when life begins.
Some of them say that they know, but there is no official position by the profession itself, is what I meant.
Well, if we are referring to the start of life as to the creation of the earth and its life forms, But as to human lives, I will have to beg to disagree that doctors and scientists do not know when human life begins. Allow me to read into the records for the Senate, records of the Constitutional Commission.
Your Honor, may I please interject at this point? Can you please allow me to sit here on the side since I cannot stay on my feet for a long time without losing my breath? Thank you.
I have no objections, Mr. President.
The Secretariat, please provide a chair for Senator Miriam.
In the records of the Constitutional Commission, Commissioner Villegas has cleared this issue in his sponsorship speech dated September 12, 1986, on the adoption of Section 9, which mandates the state to equally protect the life of the mother and the life of the unborn from the moment of conception. He stated, and I quote, "The first question that needs to be answered is the first fertilized ovum alive? Biology categorically says, yes, the fertilized ovum is alive. First of all, like all living organisms, it takes in nutrients, which it processes by itself. It begins doing this upon fertilization. Secondly, as it takes in these nutrients, it grows from within. Thirdly, it multiplies itself at a geometric rate in the continuous process of cell division. All these processes are vital signs of life. Therefore, there is no question that biologically the fertilized ovum has life." To continue the quote. The second question, is it human? Genetics gives an equally categorical yes. At the moment of conception, the nuclei of the ovum and the sperm rupture. As this happens, 23 chromosomes from the ovum combine with 23 chromosomes of the sperm to form a total of 46 chromosomes. A chromosome count of 46 is found only, and I repeat, only in human cells. Therefore, the fertilized ovum is human. Since these questions have been answered affirmatively, we must conclude that if the fertilized ovum is both alive and human, then as night follows day, it must be human life. Its nature is human. End of quote. Mr. President, also, biology and neonatal experts have spoken on the beginning of human life. Let me quote a few of them. Since the old ethic has not been fully displaced, it has been necessary to separate the idea of abortion from the idea of killing, which continues to be socially abhorrent. The result has been a curious avoidance of the scientific fact, which everyone really knows, that human life begins at conception and is continuous, whether intra or extrauterine, until death. The very considerable semantic gymnastics which are required to rationalize abortion as anything but taking a human life would be ludicrous if they were not often put forth under socially impeccable auspices. End of quote. This is from A New Ethic for Medicine and Society from the California Medicine 6768, Mr. President. Also, another quote, this time from D.J. Moran, J.D. Gorby, T.W. Hilgers, all doctors, in a written with the title Abortion in the Supreme Court, Death Becomes a Way of Life, Abortion and Social Justice, Sheet and Ward, 1974. It reads, individual human life begins at conception and is progressive, ongoing continuum until natural death. This is a fact so well established that no intellectual, honest physician in full command of modern medical knowledge would dare to deny it. There is no authority in medicine or biology who can be cited to refute this concept. It is not a theory, as Justice Blackmun wished to easily pass it off. Again, end of quote. Now, Mr. President, a medical textbook author or medical textbook authors have also confirmed this. Let me quote a few. The information, maturation, and meeting of a male and female sex cell are all preliminary to their actual union into a combined cell or zygote, which definitely marks the beginning of a new individual. This is Leslie Array, Development Anatomy, 7th edition, 1974. Zygote. This cell results from fertilization of an oocyte by a sperm and is the beginning of a human being. Development begins at fertilization when a sperm unites with an oocyte to form a zygote. Each of us started life as a cell called zygote. Source is the K.L. Moore, The Developing Human, Clinically Oriented Embryology, 2nd edition, 1977, Philadelphia, Saunders Publishers, pages 1 and 12. Now, Mr. President, every time a sperm cell and ovum unite, a new being is created which is alive and will continue to live until its death is brought about by some specific condition. This is again another quote from E.L. Potter and J.M. Craig, Doctors of Pathology of the Fetus and the Infant, 3rd edition, Chicago Yearbook Medical Publishers, 1975. Now, in the committee hearing of the Committee on Youth, Women, and Family Relations on the Protection of the Unborn Child, Dr. Santiago del Rosario from the Philippine Obstetrical and Gynecological Society has affirmed in our committee this fact. He said, the opening statement of Senator Soto, I think, it mentions about the beginning of life wherein 23 chromosomes from the mother, 23 chromosomes from the father, to make one fertilized ovum. There would be some slight correction there, Honorable Soto, he says, in those chromosomes, because actually the chromosomes from the sperm, there are 23 somatic and 1 sex chromosome also from the mother. So when they are mixed, 46 somatic chromosomes and 2 sex chromosomes will determine a human being. If it is X and Y, it will be a boy. X and X, it will be a female. Furthermore, end of quote, Mr. President. Now, furthermore, Dr. Oscar Tino, President of the Philippine Medical Association, also stated, quote, life begins at fertilization, and anything that prevents the fertilized ovum from being planted in the uterus is considered abortive. Mr. President, I believe these statements are enough proof that doctors and scientists know when life begins. That is the reason that I brought out this question to the distinguished lady, and hopefully she can enlighten me further on why that is arrived at by their committee.
Mr. President, I am impressed by the amount of research that has gone into this simple question. When does life begin? I've been quoted Mr. A, Mr. B, Mr. C, Organization D, Organization E, and so on. I can have my own quotations in my sponsorship speech, but that's precisely why I say in my sponsorship speech that doctors and scientists cannot agree on when does life begin. I have presented the negative, well, let's just say the negative side, and His Honors presented the affirmative side. We can discuss here till kingdom come, but whether each one of us wins the debate or not is beside the point. We have to have a person or a group who is considered authoritative and who is vested with the power to resolve these kinds of questions. Unfortunately, so far, within the reach of human knowledge, the question is philosophical. There is no way we can prove it either for or against. In effect, therefore, it is for me an opinion question. I will not dispute an opinion question because every person has the same right to hold an opinion as I do. I will just say this of the quotation from the Constitutional Convention records because it is a question on law. I have said in my sponsorship speech, the opinion of one delegate carried in the records of the Constitutional Convention are not binding on the entire Constitutional Convention. That is the opinion of only one delegate. We do not know how many were opposed to that statement when it was made on the floor, and the records will never tell us. I also would like to know if Dr. Bernardo Villegas, who was quoted, is a doctor of medicine. I understand that he's a doctor of economics. So for me, it is a matter of extreme curiosity that Doctor of Economics is making what is supposed to be an infallible decision on a question that the world's brightest scientists and doctors cannot even reach consensus about. But let me answer the question, expressing my own opinion and my own authorities. In my view, after extensive reading, scientists have not agreed on the start of human life. They've taken different positions. Whether human life begins at fertilization, or whether human life begins at implantation, or whether human life begins at the development of the neural nerve. However, scientists are agreed on when does pregnancy occur. They are agreed, in my view, after my own readings, that it starts at implantation because 70% of fertilized eggs do not develop into a pregnancy. I will also quote from the Reproductive Health Advocacy Network, particularly just this portion contained in their paper entitled Statement on SB 2497. Number 2, conception equated to fertilization. Conception is the common term usually denoting the start of pregnancy. The start is interpreted by some to mean fertilization or the union of sperm and egg to create a zygote, but also by others, for example, the American College of OB-GYN, ACOG, and the International Federation of OB-GYN, FIGO, to mean implantation in the uterus and the creation of a distinct biological being. To prevent this confusion, WHO, World Health Organization, and the International Committee for Monitoring Assisted Reproductive Technology, also known as ICMART, recommend stopping the use of the term conception and instead the use of the terms fertilization and implantation to refer to the equally distinct and vital stages in the beginning of pregnancy. I now come to the most telling paragraph in this paper. The bills also refer to the, quote, moment of fertilization, unquote, as if there is one specific moment of fertilization. Most developmental biology and embryology books describe fertilization as a complex process requiring the rare event of capacitated sperm and egg coming together and followed by at least 6 phases of events, each one of which can and does go awry. Fertilization takes about 24 hours, after which the result could be a zygote, no zygote, or a defective one. The outcome is difficult to predict and to measure. In fact, the first clear indication of a positive pregnancy is the elevated human chorionic gonadotropin, which follows the successful implantation of a successful fertilization. I also have a copy of the letter dated June 6, 2011, of the World Health Organization to the House of Representatives, and I quote, "To date, there is no scientific evidence supporting the contention that hormonal contraceptives and IUD prevent implantation of the fertilized ovum, while hormonal contraceptives, directly or indirectly, have effects on the endometrium that may hypothetically," I would like to emphasize the word hypothetically prevent implantation. There is already strong evidence on the primary mechanism of action of contraceptives. To date, said the WHO, World Health Organization, it is not, emphasis not, known whether thinning of endometrium has a contraceptive effect. So, in effect, what I'm saying is, there are opinions on either side of the fence here, and just as I cannot be compelled to believe which opinion should prevail, since in the first place I don't even have the authority to make that decision, in the same manner also, I would resent it if I were compelled to adopt the opinion of some other person who's not even a scientist or a doctor. I would run first of all to a doctor or to a qualified scientist on this matter. So I respect all of these opinions. Everyone is entitled to his opinion in our constitutional system, but I'm afraid I'm simply not convinced.
Thank you, Mr. President.
Mr. President.
My intention was not to convince the distinguished lady. I was asking for her opinion in much the same way that I am glad that she respects my opinion. And if I may just react to some of the points that she mentioned, like when she mentioned the World Health Organization as a source. I would rather, in my opinion, I would rather believe what the PMA is saying, the Philippine Medical Association, than the World Health Organization. Why, Mr. President? And this is my opinion. The World Health Organization works in close collaboration with the UNFPA, the United Nations Population Fund. The UNFPA is a subsidiary organ of the United Nations General Assembly, plays a unique role within the United Nations system to address population and development issues, which is an emphasis on reproductive health and gender equality. And I was informed that the UN Population Fund is one of the major donors of DKT International. DKT International is a charitable non-profit organization that promotes family planning and HIV/AIDS prevention through social marketing. One of its marketing arms is DKT Philippines. It began its social marketing campaign here in the country in 1991, introducing trust condoms. In 2010, DKT Philippines sold over 40 million condoms, over 27 million oral contraceptives, over 1 million injectable contraceptives, and over 30,000 IUDs in the country. So I would rather believe the Philippine Medical Association when it comes to the issue of fertilization. Now, if we doubt this, if we're not sure, if it's true that the doctors and the scientists are not sure, in case of doubt, Mr. President, do we kill? If there is something lying under your car, you're not sure if it's a piece of trash or it's a cat, will you run over it? If we cannot be sure, Mr. President, doesn't conscience tell us to be prudent and verify whether fertilized or implanted, if they are both unborn? And speaking of unborn, Mr. President, Commissioner Villegas made that sponsorship speech in the sponsorship of that particular portion of the Constitution which says that the state shall protect the unborn from conception. And the Constitutional Commission approved it in its entirety, Mr. President. So that's the reason I brought it out. Nevertheless, as I said, the distinguished lady is right. That is my opinion, and she has others. Now, just one more question, if
Mr.
she will-
President, with the indulgence of the Majority Floor Leader, I would just like to put on record to add to the discussion. The Majority Floor Leader was quoting the records of the Constitutional Commission, no?
Yes.
And I would just like to, as I mentioned, put on record that according to Father Bernas, and I quote, the provisions which the Majority Floor Leader had mentioned clearly reflect a Catholic approach to the problem. The advocacy of the provision was borne principally by Bishop Bacani and Commissioner Bernardo Villegas, a stalwart Catholic layman. End of quote. I mention this simply to emphasize the point raised by my co-sponsor that these are opinions made by people just like us. And just to further elaborate on the point, my co-sponsor in her part 1 of her sponsorship speech had mentioned that Pope Paul VI had issued his encyclical Humanae Vitae, wherein it condemned the use of artificial methods of contraceptions, including the pill. And this is what I'd like to put on record. The day after the release of the Humanae Vitae, 87 Roman Catholic theologians issued a statement published in the New York Times dissenting from the encyclical. Married couples, the theologians stated, may responsibly decide according to their conscience that artificial contraception in some circumstances is permissible and indeed necessary to preserve and foster the value and sacredness of marriage. Eventually, over 600 theologians joined this statement. And one further point, on November 15, 1968, the National Conference of Catholic Bishops issued a pastoral letter hoping to calm the controversy. Although the letter strongly supported the Pope's stance, referring to artificial contraception as objective evil, the bishop also acknowledged that certain circumstances may reduce moral guilt and that the decision to use contraception is a matter of individual conscience. So I put this in record to emphasize the point raised by my co-sponsor that it is an opinion question which may not really be easy to resolve during our lifetime.
Yes, Mr. President, I agree. As a matter of fact, only the Supreme Court will be probably able to decide that later on. But then again, whatever opinion we air here, the important thing is that we are able to voice it out, and the majority will prevail. We are ruled by the majority, not by dissenters. So hopefully I can take that up also, the point that was raised by a distinguished lady from Taguig. I can take that up later when I go to her portion of the speech. May I just have one more issue on the sponsorship speech of the distinguished lady sponsor, Senator Miriam.
Mr. President, with the permission of the Majority Leader,
Senator,
since this is a very important issue, before the Majority Leader gets into the second point, I just would like to find out the importance of this discussion with regard to the RH bill, because from what I understand from the Majority Leader, he says, and he quotes, that life begins during fertilization. I don't have a problem with that. I hear also from the sponsor in her earlier remarks that it is, based on her studies, probably during the period of implantation. Now, just for clarification, why are we discussing this issue of when does life begin, and what is the import of whether it is fertilization or implantation? I could hazard a guess, Mr. President, but may I first know from the gentleman, from our Majority Leader, the import or the implication of this discussion to enrich the records of the Senate, Mr. President.
Okay. Mr. President, I was somehow puzzled by the statement of one of the distinguished sponsors. That is the reason that I brought this out. Although this is being debated in other venues, not even also in the House of Representatives, but I wasn't influenced by any of that. I was just surprised at the statement made by the distinguished sponsor by saying that when does life begin? No one knows. That was the statement I recalled from her sponsor's speech, and that's why I looked into it and I asked myself if really no one knows. Apparently, the opinion is that when the sperm meets the egg and is fertilized, that is a human being.
I agree
that is not
totally
a
with
fish.
I agree totally with the majority leader. I understand also the position of the sponsor.
Okay. Just to
Implantation.
complete, I'm sorry, just
Yes.
to complete that, to answer his question, Mr. President, with your permission, I'm very sorry. The bill, as it is proposed now, contains the use of contraceptives, and most, if not all, of the contraceptives are listed as abortifacients.
That is based on the
Based on the
issue of fertilization.
Yes, on the
Yes.
issue of fertilization.
So just to enrich the records of the Senate, in effect, since if assuming that it is by implantation and not fertilization, then condoms which do not allow the sperm and the egg to meet may be legal. But if it is implantation, or the other way around, is that then many of these pills are abortifacient.
Yes.
That is the essence why we're discussing this.
Yes.
Just to put that on the record. Isn't that correct?
Yes, Mr. President.
Thank you, Mr. President. I just wanted to make sure that that is in the record as well. Thank you.
Thank you, Mr. President. The Senate President, Mr. President, wishes to make a statement.
With the permission of the majority floor leader and the distinguished sponsor of the measure, I remember in my persons and family relations in that course, and that was, I took that up more than 50 years ago, that rights begin at conception. I do not know whether this principle has been changed, but I think in the application of the rule of succession, an unborn child conceived is already entitled to some rights. And I think we should, when is conception? When does conception begin?
As I meant,
I suppose the people who crafted our civil law must have adapted this concept on the basis of scientific knowledge, and we ought to explore the possibility of when is conception. Was it implanted at the point of implantation or at the point of fertilization?
no, Mr. President, but the Constitution is very clear. It says in the Constitution, the state shall protect the unborn from conception. It does not say there from fertilization. That's what the Constitution says. And that's why we're trying to drive home that point, Mr. President. But anyway, may I now go to the second question on the sponsorship speech of the distinguished lady. You mentioned statistics that I also heard from Congressman Lagman in the House of Representatives. You mentioned that there are 11 mothers that die every day. If I recall it right, you mentioned it twice or three times, Mr. President. So may I know where you got that figure, Mr. President?
Opo. From the 2008 National Demographic and Health Survey by the National Statistics Office. The estimate is 11 to 12 mothers, but media chose to use the estimate of 12. So I've even used the lower estimate just to give the opponents as much room as possible for debate.
So this is this the same document or survey that I'm holding now that was given to you, the Philippines National Demographic and Health Survey 2008.
Yes, presumably.
Yes, so this was given to you in the committee, submitted to committee, or just given to you, Madam President?
I did not attend the committee hearings because I'm not a member, but it was given to me officially.
What is the source of this survey? Who is the source, Madam President?
National Statistics Office.
National Statistics Office. Do you think we should give weight to this survey, Madam President? Mr. President, I'm sorry.
What is the meaning of give way?
Well, no, I mean give weight.
Weight.
Sorry. Give weight.
Yes, definitely, if you will allow me to explain. The source of my data on, quote, 11 women die of childbirth every day in the Philippines, unquote.
May I see? What page, please?
I'm using another document. It is entitled Data on Adolescent Sexual Behavior by UN Population Fund. And it has a passage here. If you will give me the liberty, I will quote from it directly. There is empirical basis for the 11 deaths per day. This number, actually, the advocacy message carried the number 11 to 12, but media picked up only 11. Is based on the 2005 estimates developed by WHO, World Health Organization, UNICEF, UNFPA, and the World Bank, and reported in a publication entitled, quote, Maternal Mortality in 2005. In the document, the number of maternal deaths in the Philippines was estimated at 4,600. The estimates were made following a standardized methodology across countries to ensure country-to-country comparability, which is helpful in tracking the country's progress in the achievement of the Millennium Development Goals. Thus, the numbers may differ from government statistics, which may use varying methodologies. The latest Philippine government statistics on maternal mortality are based on the 2006 Family Planning Survey published by the National Statistics Office, which shows a maternal mortality ratio, or MMR, of 162 maternal deaths per 100,000 live births. May be allowed to request notice that the figures are mere estimates and are not absolute numbers of actual maternal mortality cases in the country. It's impossible to go around the country requiring, for example, mortuaries or cemeteries to keep track of people who are dead and about to be buried to determine what was the cause of the death. This is the reason why there can be no factual absolute number. The above UN-World Bank document explains the difficulty in making the estimates, especially in countries such as the Philippines, for 3 reasons. Quote, first, it is challenging to identify maternal deaths precisely, particularly in settings where routine recording of deaths is not complete within civil registration systems, and the death of a woman of reproductive age might not be recorded. Second, even if such a death were recorded, the woman's pregnancy status may not have been known, and the death would therefore not have been reported as a maternal death, even if the woman had been pregnant. Third, in most developing country settings, where medical certification of cause of death does not exist, accurate attribution of female deaths as maternal death is difficult, unquote.
Thank you, Madam President. Mr. President, the distinguished lady, thank you very much, because I'm glad you said that. Therefore, the headline is inaccurate. Alam nyo naman siyempre kung paano daling kasi ng media, 11 mothers a day die. Hindi eh.
Well, there is no evidence that it is either accurate or inaccurate. So
No.
it is also unfair to say that it is inaccurate. It could be accurate, it could be inaccurate, because there is no scientific, methodological, organized, structured, fiscally pragmatic way of proving the deaths.
That's why, Mr. President, it is a survey. Now, are you aware that this survey was conducted by the USAID, the United States Agency for International Development? Therefore, this information by our NSO is not their sole and actual findings, but a collaboration with an independent foreign organization from the United States. And this same USAID works hand in hand with manufacturers of contraceptives such as DKT. So, I'm glad that the distinguished lady was able to help me bring home the point that this is not actual figures. There are no names, there are no faces to the 11 maternal deaths a day, Mr. President.
Senator Cayetano will have a fuller answer to the questions that I gave. But at this point, because it has been brought out that maybe the factor of condo manufacturers might be a factor in this debate, allow me to say that every time the government spends money, a certain sector of society makes money. The main purpose of government is to maintain peace and order. Every time we order for an army to be created or a national police force to be created, someone makes money. The person who makes guns, for example, the person who makes helmets, police uniforms, other weapons of destruction or personal violence will immediately make money. Even the person who makes socks or makes shoes will make money. Everything the government does, because it will entail an expense, will mean a profit in a capitalist society for the business person who is allowed to engage in that particular business. So it does not necessarily mean that raising an army or creating a national police force is necessarily a flawed project just because some people will make money. Or let us see the function of government. It has to provide schools. Every time government builds school buildings, it provides profits for people who make the materials that go into school buildings. Even people who make chalk or pencils make a profit. So that for me is not a viable argument in this kind of a debate. We have to elevate our political discourse to a higher level. Senator Cayetano.
Mr. President, if I may just add some details to the discussion.
Well, just to react to that initial statement, Mr. President, I hope I'm wrong, but I hope the perception that I'm getting is that this bill is about money, not health. If in that case,
That's not fair.
no, that's the perception I got
So,
when you.
well, please correct your misimpression. I don't want to do it for you. You have to do it sua sponte by yourself. This is not about money. This is about the right to health, particularly the right to reproductive health. And that's a cheap shot.
Well, I don't think so, Mr. President. Anyway, you're entitled to your opinion. May I listen now to what the distinguished lady is going to say? Because just to continue with the reaction to what the distinguished lady said, this is a survey. This cannot be accurate, because if they will insist that this is accurate, then they will have 11 maternal deaths a day, 365 days, 4,015 a year, 16,000 in month. There should have a death certificate. Kahit pa paano, yung mga death certificate po ito mga ito. Ay, di ba? So itong NSO at saka USAID, they will be able to back this up. So may I ask the committee to furnish the Senate a copy of how this survey was arrived at. If they can furnish that, Mr. President, I will try to urge 13 senators to vote for this bill tomorrow for third reading.
Thank you, Mr. President.
They will be able to present that those names, Mr. President. 11 mothers a day.
Mr. President, I am prepared for the voting.
Even just 11 mothers that died yesterday, the Senate President said.
We are prepared to submit the information and the data that we have. If I may just give to the page to give to His Honor. This is the document that I will be citing, so it is easy to follow. this is based on the conclusion that 11 women die each day, are based on very specific age group categories. From the age group of 15 to 19, the maternal death rate per day is 1.1. From 20 to 24, it's 3.2. And I mean, I will not belabor my point because it is in the record.
Sorry, yes.
So if you add all the age groups together and you divide this by the 100,000
Yes.
live births, the total is 11.1. Now, to the extent that this is somehow an estimate, I would agree with my co-sponsor that this 11 people on a particular day, tomorrow may be 13,
Yes.
today may be 10.
Or maybe
when
2.
When it happens on
Or maybe
But
2 yesterday.
the average, there are statistical ways to determine probability, and this is the average, Mr.
Yes.
President.
Madam
Now,
President, Mr. President, may I just cut in if you may?
yes.
The statement of the Senate President, which I aired, was a rip. You know, it was just in jest. I know, we know, it's an average. You're saying an average. There are days
And
that it would probably
there is
30,
statistical-
and there will be days that there will be none. Yes,
I
we
doubt that.
understand
I
the point.
highly doubt that there are days that are none. And if I may be allowed to present the additional data that I have, this is data that was just gathered by my staff. In terms of the maternal mortality rates in certain hospitals, in East Avenue Medical Center in 2010, there were 26. But for maternal morbidity cases, these are those that did not die, but whose death were prevented because of special care that these tertiary hospitals could provide. There were 2,776 complications of pregnancies and deliveries, 1,329 spontaneous abortions, and 627 other pregnancies with abortive outcomes. So if you add that, that's close to 5,000. In East Avenue Medical Center alone, I have figures for North Mindanao Medical Center, Rizal Medical Center, Taguig Pateros Hospital, and we still have a lot more in our files. So, Mr. President, I am talking of hospitals that provide the best care. What about the secondary hospitals, the primary hospitals, the rural health care units, and the biggest case of deaths will be in the very homes, in the barangay where the women sleep. I beg I will probably even agree with the good majority floor leader that the figures are actually probably much higher due to the lack of data. It will not be lower because our hospitals that can verify these figures already show that the data is higher. And one last point to address the statement that there are no faces to this data. Right here in the session hall, I will tell you now that we have women who live simply because of medical intervention. Bing is 38 years old. She's a scavenger from Manila. She has 5 living children, all of whom were born within less than a year of each other. She fed her babies brown sugar and water or coffee and water. She sought a ligation because she did not want to have more children, but she could not afford the ligation fee being charged by their hospital, and it was not provided by her local government or the national government. Gigi is a battered wife. She is also here. She also gave her children brown sugar and water. She has 4 living children. She wanted a ligation but was not able to get one. Emma is 47, a devout Catholic. She helps nuns conduct Bible studies in communities. She has 7 children, and she wanted to get pills, but it was not available in her health center. I can go on, Mr. President, but these are the faces of the women who want reproductive health care.
Yes, and they are given now, Mr. President.
They do not have access in many local governments. They are not
We should
available,
bring that
Mr.
up to the
President.
Department of Health. That is not the answer that the Department of Health has been giving us.
Mr.
In the
President,
past, so
there
many
is a
hearings
law.
that I keep on asking about this, that they are doing it. Yes, we are giving so-and-so information campaign and all this stuff. They have been saying that they are making it available in all these programs, Mr. President. Because aside from what you are getting as feedback, I'm getting feedback too from doctors, hospitals, and they were shocked at the 11 mothers a day, the statement.
Well,
They
Mr.
are shocked
President,
because they said that In our hospital, there's no mother who's died of,
Please, I
of
would love to
maternal,
meet those. I would
That's
love
what
to
they
meet
say.
those doctors who said that,
Yes,
Mr. President, because
well-
I am not aware that there is a mother that there is a hospital where a mother has not died.
No, no, a mother probably died of dengue, of some other.
Childbirth related, Mr. President. I beg
not-
to disagree, and I would be happy.
Childbirth related.
happy
Okay,
to-
that's
to-
different. That's different from what we're pertaining to right now.
No, Mr. President, the bill refers to the whole range
Okay,
of
good.
childbirth, pregnancy,
I'm glad
reproductive health
you
related-
mentioned that, Mr. President. Let's go to the bill.
Okay.
Let's go to the bill. I'd like to thank the distinguished sponsor, Senator Mina and Professor Santiago, for answering our questions. May we go to the bill now so that we will be able to drive home the point that I was just saying just about now.
Senator Arroyo is recognized.
Mr. President, permit me to just interject because I get lost in the debate. I don't know anything about fertilization or implantation like the way Senator Recto knows it. No? So, can both sides enlighten me because I'm dumb when it comes to this. What is the position of the majority leader when it comes to fertilization, implantation? When does life begin?
When the sperm meets the egg, Mr. President, fertilization.
That is fertilization. All right.
Yeah.
That's life begins. By that time, Mr. President, it already moves. It will move. It will move from that to attach itself to the wall. How can it move if it's not alive, Mr. President? That's a human being already. That's my opinion.
Now, can I ask Senator Cayetano, what is the position of the sponsors? When does life begin? Is it fertilization or implantation?
Well, Mr. President, I share the view of my co-sponsor, Senator Miriam, wherein she states that this issue has been debated by medical and scientific experts, and you know, there will be no. I do not personally believe that there will be an end. There will ever be a resolution to this issue. So what I can tell you is the basis for the bill, and the basis of the bill are the statements that the findings that are supported by the WHO, and to put on record, to differentiate between fertilization and implantation. I was trying to draw it for you.
Yes.
But the words will probably...
drawing.
Fertilization is the process by which a single sperm gradually penetrates the layers of an egg to form a new cell, known as a zygote. A fertilized egg by itself cannot survive. Implantation in the uterus is necessary for viability. Case in point is an ectopic pregnancy, which I also demonstrated for you on the paper, wherein when the fertilization occurs and the egg does not go down and implant itself in the uterus, it is left in the fallopian tube. And if that is not removed, a woman could die. And let me just put on record, in many Latin American countries, this was the issue that was faced, this was the dilemma faced by medical professionals, because a law was instituted preventing medical professionals from intervening. And what happened was women were dying before their very eyes because they could not touch and save the woman's life until that cell had manifestations of I don't want to use the term life, no, but manifestation of life as defined by the law. And what happened then was really a horrible part of medical history, because women died and the doctors were afraid that they would be put in prison to save the woman's life, when in fact that cell, that zygote, would never prosper. But because of the definition of the law, the OB-gynecologists and the doctors were prevented from saving the mother's lives.
Well,
And I
Mr.
hope I did
President.
not feed you too much information. You will be baffled.
Mr. President, if you would notice, the distinguished lady used the word survive, for the zygote to survive. That means it's alive.
It is.
May buhay na nun.
you know, to me, the debate or rather the deliberations, should kind of distinguish between this, because it is really when life begins that is at issue here. But so far it's not clear. So.
And I will reiterate the position that my co-sponsor and I take, is that I do not believe that we will ever resolve this issue, because these are opinion questions, and His Honor has very strong opinions on fertilization being the point in time when life begins, and I choose to adhere to the WHO pronouncement that implantation is in fact the point of viability and where pregnancy is defined to occur. I have a number of cases. It's a little bit medical, so I won't belabor the point, but I can just put this in record. Aside from ectopic pregnancies, there are other kinds of pregnancies that will never result in a child, because without the proper implantation, it will either kill the mother, or it naturally aborts itself. And I understand that close to 50% of these fertilization naturally abort. I don't know if I'm using the right term, but naturally are naturally expelled.
Well, I would like to
Mr. President, with the permission of Senator Joker.
Senator Lacson is recognized.
Because I'm going to modify his question. When would life probably begin?
Yes.
When we talk of implantation, necessarily there's probability of life after sexual intercourse. Is that
Yes.
a correct statement?
Yes.
Excuse
Well,
me,
no.
can I sit down already?
Yes.
I'll try to
I'm
follow.
sorry.
Thank you,
It's a
Senator.
very
You may go ahead. I just.
It's very interesting intellectual debate, but I'm confounded really about how we could make this clearer, so that when we vote, we know exactly our
Yes.
position.
Well-
Thank you, Mr. President.
Thank you, Senator Arroyo.
To respond to the question of Senator Lacson, the WHO states that a fertilized egg, well, and I believe this is the position of every medical professional. I don't think there's anyone, this statement I'm about to make is non-debatable. A fertilized egg by itself cannot survive. So on its own, if a sperm and an egg meet, it cannot survive without implantation.
Ayun na naman yung survive, Mr. President. Survive, ibig sabihin, alive.
No, well, again, I ask for indulgence in my use of terms. I am not a scientist nor a medical expert. But what I mean is a fertilized egg, the first component, meaning the presence of a sperm and an egg, cannot graduate. Let me use that term. Cannot graduate into a living person without implantation.
Mr. President.
The answer, Mr. President, to the question
Viable.
modified by Senator Lacson, the best answer comes from God. Now, before we meet Him, it is best that we are prudent. Huwag tayo nagdudulong-dulungan sa Panginoon. Yun ang
Point of
pinakamaganda.
order. Mr. President, there is no proof that God is a male.
Thank you, Senator Santiago.
The observation, because nobody knows that. No? After, pardon the word, pardon my French, after sexual intercourse, nobody would know if it's going to be fertilized. I mean, we don't know if the
It will be
egg,
viable.
Yes, there's probability of life, and nobody can say whether male or female. Between
Well, no,
partners,
no.
nobody would know.
First of all, before you even distinguish between male and female, you do not know if and it's not a question if you do not know, you personally do not know.
Yes.
Even the universe cannot tell you that there is life, because like I said, about almost 50% are naturally expelled. So without the implantation, 100% of them will not become life.
But would you agree with me that in case of any probability of life, we should put ourselves on the assumption, or we should assume that there's life?
Yun.
Yes, I definitely, I mean, I am a mother, and I personally, I adhere not just to the Constitution, but morally that is the position I take. But having said that, Mr. President, let me qualify that I will not allow my statement of my personal position and my belief to be twisted to mean that I do not adhere to the WHO conclusions and findings, which are the current practice in our country, that the contraceptives that are currently available that are not abortive fashions, let me repeat, are not abortive fashion, should find, I cannot support that we can find a different way of qualifying them, such that they would be taken out of the list of contraceptives that should be available to women, because that to me would be murder.
This brings me to my next point, my next question. What's your view on the morning after pill, the so-called Plan B?
Mr. President, with due respect, I will reply to your question when I pull out my notes. The disclaimer that I do make is that I am not a doctor, and even if I was, I don't think any doctor can also be used as an expert unless that is their special field of training. And so I will simply read on the record the findings on the morning after pill. I will not begin to express my views for or against it.
Thank you. I'm a co-author, but that's very important to me.
Yes.
The classification of morning after pill.
And just to put on record, what I do know is that the morning after pill is not considered a legal contraceptive. It is not available for purposes of contraception. So, if I'm not mistaken, but I do want to check the record, it is not.
Abortive.
It is not available. So it may be considered abortive fashion. But let me check, because I do not know offhand. I may be mistaken.
Thank you. I'll await your reply. Thank you.
Mr. President, if I may,
Senator Recto is
just again to provide more confusion, or just to put into the record again some of the observations, just to also to enlighten us during the period of voting at the appropriate time. I agree with all the statements as well made by the sponsor, no? But let me add one other item on the issue of fertilization and implantation. As I am familiar with in vitro fertilization, for example, no? That process is when there is difficulty between a man and a woman to have a child, and therefore they seek medical attention, for example, and they get the sperm of the male, the egg from the female, put them together in a dish, and you have fertilization outside of the woman's womb. After a few days, or after that embryo multiplies, or the cells multiply, that is now put in the woman, implanted in the uterus, for it to have a full human being, eventually to have a fetus, so to speak. So clearly there was life during fertilization, because without life, there is nothing to implant to begin with. But yes, let me mix into the record that both are correct. And I am not against the RH bill. The question here under this topic is, which contraceptives will be legal and which will be illegal? That is basically the issue of why Senator Enrile, the majority leader, myself as well, who's been a student of all of this as well, artificial insemination, in vitro fertilization, so on and so forth. It is not so much the protection of the unborn, but the right to life. So at the appropriate time, we will even defend, or rather amend, the name of the bill of Senator Enrile, Senator Soto, and that of mine. But I do know that we need to pass something on reproductive health. And let me go to the second point that was raised, the question raised by Senator Soto also. I would just like to see the relevance of the maternal deaths. While I agree, and I've seen that with my own eyes, how many women die from giving birth? And I think we should allocate resources to ensure that no woman dies in this country while giving birth. But I do not think that the solution is to spend billions and billions of pesos through contraceptives. I do not have a problem with people buying contraceptives or with adults using contraceptives. But having said that, I do have a problem with minors given contraceptives, let's say in barangay halls or barangay centers, without the permission of parents. But I will get to that at the appropriate time. The point is, there was a question on How many maternal deaths do we have in a year? And you know, unfortunately, as we speak today on the RH bill and maternal deaths, it is very important. But in the last 3 weeks on TV, you could see you've got thousands and thousands of problems on dengue. When we decide here how much money we spend on one item, and there is no corresponding revenue measure, for example, for that particular, it is a zero-sum game. Meaning to say, para may disjoint, na alam natin na napakaraming dengue may problema ngayon sa ating bansa. Na hindi natin napag-uusapan yung problemang din yan. Na maraming namamatay din dyan. At alam natin kaagad na namatay dahil sa dengue. Halimbawa, in the issue of maternal deaths, what is the relationship? I mean, wala akong problema na walang babaeng dapat mamatay. Let's ensure that our hospitals are capable to treat all these women. But what is the relationship with regard to contraceptives or giving contraceptives to minors, for example?
I will answer the question on the women. On the minors, if the gentleman doesn't mind, I will take that up after the majority floor leader has finished his interpellation, because you raise a different topic. Yes. But on the maternal mortality rate, and on the reducing maternal mortality, it is a very basic fact that is known to doctors, especially those in the maternal health care. Pregnancies that are too close together are more riskier for women. That is documented, and that is non-debatable.
Yes, I agree.
And the recommended spacing is 3 years. Now, if you will follow if you will religiously follow a specific family planning method, be it natural or artificial, then you improve your chances of having your next pregnancy being a healthy pregnancy. Without some form of family planning, it is very difficult for a couple having an active sex life to prevent a pregnancy occurring anywhere from 2 months after your
I understand totally, and I'm with the gentle lady.
And that is where contraceptive comes in. That is my reply.
Correct. But the problem is, these 11 deaths every day does not necessarily mean that they were unwanted pregnancies. Isn't that correct? It doesn't, based on the data. It does not necessarily mean that they were unwanted pregnancies.
No, but Mr. President, let me remind the gentleman that this bill is the Reproductive Health Bill. It covers all reproductive health issues of women. So it covers...
Also of men.
Of men, correct. I mentioned women only because of the childbirth issue. Yeah. So whether we tackle the right of a woman to have a healthy pregnancy, or the right of a woman to specifically plan her pregnancy so that she has access to contraceptives, access to information, all of this falls under the Reproductive Health Bill, Mr. President.
Correct. I understand that, distinguished Senator. I just wanted to put on the record that these 11 deaths a day, or 5,000 a year, today we have 40,000 dengue cases in relation to that as well. I just like to put on the record as well that it does not necessarily mean that the reason why these women are dying is because of the lack of contraceptives or of education and information.
A big part of it is because of the lack of access to information, because the mortality rate is greater in the social economic classes that are lower.
Yeah, and the issue is access and affordability.
Correct.
Okay, so I'm willing to work with the sponsors on the issue
I have always known
access
that you were.
and affordability. So do you want it to be VAT-free? Why not?
Of course.
Duty-free?
Why not?
Why not?
I
do have many other...
I have strong opinions on that, but if it is for those who can, if it is for those who cannot afford, in the same way that I am for duty-free importation of medical equipment,
Yes,
I
that
am.
is right.
Thank you.
I do have a lot of more questions, but unfortunately I'm not prepared today to do everything. And this is a very important debate, and I'd like to congratulate also the majority leader for starting the interpellations, and maybe from time to time, so that Senator Roy is enlightened. Pardon me, Mr. Senate President, to stand up from time to time, because I'm sure I would be able to help enlighten Senator Roy on this topic.
Thank you, Senator.
Yes, Mr. President. Besides, Mr. President, well, for the information of Senator Arroyo, Senator Recto originally wanted to take up medicine, but his mother did not allow him because he wanted to specialize in being an OB-GYN. Mr. President,
Just a point of clarification with
Senator
the
Osmeña
permission.
is recognized.
The Constitution uses the word conception. May we just have, you don't have to answer now, may we just have a definition of conception vis-a-vis implantation, fertilization, so that we may be clarified.
Well, I do have a definition here, and it states that the state of a female after conception and until termination of the gestation. That is the definition of pregnancy. And then it goes on to say, conception is the implantation of the blastocyst. It is not synonymous with fertilization. That's it. It is not synonymous with fertilization.
That definition comes from which
This
source?
is provided to me by the WHO, and there is a specific quote from the Committee on Technology, the American College of Obstetricians and Gynecologists, obstetric gynecologic terminology.
Does the distinguished sponsor believe that this was also the meaning of conception when the Constitutional Commission debated and inserted this provision?
Well, I will respond based on the records that I have, the reference material that I have with me, and this is quoting. This is a commentary of Father Bernas on the Constitutional Commission's appreciation of the phrase "When does conception begin?" While the provision does not assert with certainty when human life precisely begins, it reflects the view that in dealing with the protection with life, it is necessary to take the safer approach. The intention is to protect life from its beginning, and the assumption is that human life begins at conception and that conception takes place at fertilization. But again, I will repeat the statement that I also put on record earlier, that no less than Father Bernas also stated that this provision clearly reflects a Catholic approach to the problem. The advocacy of the provision was born principally by Bishop Bacani and Commissioner Bernardo Villegas, a stalwart Catholic layman. Let me also remind the body that I had also read into the record that no less than 600 theologians and priests dissented from the position taken by the Pope. So I go back to the statement made by my co-sponsor that this is a debate that is based on an opinion, which I think we all have very personal feelings about it, and people coming from different religious backgrounds will have different religious beliefs, because even in the Catholic Church, it is different. I emphasize this because it is my mandate as a senator, as I do believe it is the mandate of every person here, to make a decision that will be applicable to every Filipino and not just to Catholics or any particular religion.
Does the sponsor believe that when the Constitutional Commission in 1986 passed this, it must have adopted the Catholic, for whatever reason there is, definition of conception, and therefore they meant fertilization. And the interpretation or the definitions that are being used or propounded by the World Health Organization is irrelevant. Now,
Sorry, the
the way
definitions being propounded by
the World Health Organization and the USAID and whatever other people, you mentioned 600 theologians, that would be irrelevant to the meaning of the word conception as it was construed at the time the Constitution was ratified.
I don't believe so. My humble opinion, Mr. President, is that we as a Congress, as a lawmaking body, have the ability, the authority, and the responsibility to also construe the meaning of the Constitution, and that is the opinion that I take. And again, not being medical and health experts, then we also look at the health and medical experts. Like my co-sponsor had mentioned, many of the deliberations and discussions made in the Constitutional Convention were by people who were not medical experts, and therefore I believe that the weight that the discussions brought about by this august body will be instrumental in clarifying this issue.
All right, that would be your opinion, and we respect that. But however, as a layman, as a non-lawyer, as a non-doctor, I believe that the meaning of the word conception, as it was utilized in the Constitution, was precisely what Father Bernas and Bernie Villegas meant it to be, simply that life begins at fertilization.
Well, actually, Mr. President, let me clarify that. Father Bernas says in his book that there is no attempt to pinpoint the exact moment when conception takes place. So following the argument of the gentleman, Father Bernas himself also says that this discussion and deliberation was not intended to pinpoint the exact moment when conception takes place. That is in his book.
Does that necessarily mean that you don't know the exact second when the sperm meets the egg?
No, I believe this.
Nobody knows that.
I do believe, based on my readings of Father Bernas' work, and the very clear statement that he makes is that clearly he understands that this issue is subject to emotional, religious, and moral persuasion.
So therefore you're saying
have our own opinion on it.
Congress now has the power to define whether conception is fertilization or implantation. That's what you're saying.
What I am saying is that I do not believe that we are bound by any specific statement made in the constitutional, in the records of our constitutional commission, by our constitutional commission. I do believe that we also have the authority and responsibility to explore the intention of this constitutional provision.
Very good. I will not belabor this point today, but I would like to reserve my right to take this up in the future.
Thank you.
Thank you very much to
Mr.
the
President.
Majority Leader.
Thank you, Senator Osmeña. In response also to Senator Osmeña, in reaction to some of the points or the lines read by Senator Pia on Father Bernas' book, meron din mo kami Father Bernas eh. Ito naman sa Constitutional Commission made by Father Bernas. He said, the intention is to protect life from its beginning, and the assumption of human life begins at conception. That conception takes place at fertilization. This is records of the Constitutional Commission 799. And he said that because of the voting that was being done in the Constitutional Commission while sponsoring that particular provision. To quote, conception is defined as fertilization. This is from Dr. Bernie Villegas. Conception is defined as fertilization, the moment the egg is fertilized by the sperm. And the majority decision at that time, members of the Constitutional Commission, the vote was 32-8. He continues to say, it is when the ovum is fertilized by the sperm that there is human life. Just to repeat first, there is obviously life because it starts to nourish itself. It starts to grow as any living being, and it is human because of the moment of fertilization. The chromosomes, etc., are combined. Now, if we're talking of opinion here, then if there is no Supreme Court decision on this, there is a lot of weight on what transpired in the Constitutional Commission, Mr. President. And if it is an opinion, and our opinion, and the opinion of the distinguished sponsor and others who are for the contraception in the RH bill, then we do not need a law for an opinion. Same thing with information, Mr. President. If we're just going to give information to every Filipino Filipino about the reproductive safety and maternal safety. We do not need a law, Mr. President. We can go ahead and give the information. Why put your opinion into a law? That is the point. But anyway, if I may continue on, again, on the distinguished sponsor, going to the main bill itself, Mr. President. During the sponsorship speech of the distinguished lady on Senate Bill 2849, this was made last June 7, 2011. You made mention of the bill's objectives and salient features. And if you will allow me and correct me if I did not get it correctly, so that I could probably save time from you recalling all these objectives and features, I have here the list of what you have mentioned in your speech. And I just would like to like the distinguished lady to confirm if I got them complete and correct. The bill aims to, number one, save the lives of the mother and unborn. Number two, provide Filipinos with information on their reproductive health so they can make informed and intelligent decisions. Number three, provide Filipinos with access to healthcare facilities and skilled health professionals before, during, and after delivery. And you go on to say that the features of the bill, number one, access to health skilled professionals before, during, and after delivery. Number two, establishment and upgrading of facilities and training of skilled professionals. Number three, addressing HIV and other sexually transmitted diseases. Number four, access to different family planning methods. And number five, age and development appropriate reproductive health education. Did I get it correctly, Mr. President? Is this the salient features and the aims of the bill?
It appears so, Mr. President, and there obviously would be a few other features of the bill that we did not highlight, but these are consistent with the items that I believe that we highlighted during the sponsorship speech.
Okay, thank you for that, Mr. President. Now let me proceed with the first aspect of my interpellation. We tried our best to go through the bill and try to dissect it, and which we are proposing to pass. And to get a full grasp of the measure, I even subdivided the various provisions found in the bill according to the objectives and features. And more or less, here are the pertinent provisions applicable to the first objective of the bill, which according to you, save the lives of the mother and the unborn. I found it in Section 3, Guiding Principles, letters B, C, D, and Section 4. Now, I have nothing against this objective at all. As a matter of fact, we are mandated by no other than our Constitution to protect the life of the mother and the unborn. My problem, however, is that the committee might have overlooked some laws which I find very similar provisions, either in wording or in spirit, with your proposed bill. Let me show you the comparative chart to give you a better look on what I'm talking about. The laws related to saving the lives of the mother and the unborn are the following: Republic Act 9710, or an act providing for Magna Carta for women; PD 603, or the Child and Youth Welfare Code; Republic Act 9262, or Anti-Violence Against Women and Children; Republic Act 8504, or the Philippine AIDS Prevention and Control Act of 1998; AO 2008-0029, implementing health reforms for rapid reduction of maternal and neonatal mortality; Children's Health Program of the DOH, and the Family Planning Program of the DOH. Let me read one of the pertinent provisions of these laws and the DOH programs relative to your proposed bill. In the pertinent provision of your bill, letter B says, respect for, protection, and fulfillment of reproductive health and rights seek to promote not only the rights and welfare of adult individuals and couples, but those of adolescents and children as well. Letter C, effective reproductive health care services must be given primacy to ensure maternal health and birth of healthy children in line with the state's duty to promote the right to health, responsible parenthood, social justice, and full human development. Now, I call your attention to Republic Act 9710, an act providing for Magna Carta for women. Section 17 says, women's right to health. A, comprehensive health services. The state shall at all times provide for a comprehensive, culture-sensitive, and gender-responsive health services and programs covering all stages of a woman's life cycle and which addresses the major causes of women's mortality and morbidity, provided that in the provision for comprehensive health services, due respect shall be accorded to women's religious convictions, the rights of the spouses to found a family in accordance with their religious convictions, and the demands of responsible parenthood, and the right of women to protection from hazardous drugs, devices, interventions, and substances. And call your attention also to the Child and Youth Welfare Code, which says, Article 11, promotion of health. The promotion of the child's health shall begin with adequate prenatal and postnatal care both for him and his mother. All appropriate measures shall be taken to ensure his normal total development. It shall be the responsibility of the health, welfare, and educational entities to assist the parents in looking after the health of the child. Now, related to this is a DOH program A020082 and 0029, Strategy to Rapidly Reduce Maternal and Neonatal Mortality. Maternal, Neonatal, and Child Health and Nutrition, MNCHN. It outlines specific policies and actions for local health systems to address health risks that lead to maternal and neonatal deaths. The MNCHN strategy works to ensure that all pregnancies are wanted, planned, supported, and well managed. Deliveries are facility-based and managed by skilled birth attendants, and all mothers and newborns receive good postpartum and postnatal care. The following programs shall be pursued to attain these objectives: improved health services delivery, proper regulation of health facilities, capacity building of healthcare staff, improved health financing, and establishment of governance mechanisms to ensure political commitment and accountability. And on children's health 2025, the ultimate goal of Children's Health 2025 is to achieve good health for all Filipino children by the year 2025. And a health status objective for child health. Number 1, it says, reduce infant mortality rate to 17 deaths per 1,000 live births. Number 2, reduce mortality rate among children 1 to 4 years old to 33.6% per 1,000 live births. Number 3, reduce the mortality rate among adolescents and youths by 50%. Risk reduction objectives, increase the percentage of fully immunized children to 90%. Number 2, increase the percentage of infants exclusively breastfed up to 6 months to 30%. Number 3, increase the percentage of infants given timely and proper complementary feeding at 6 months to 70%. Number 4, increase the percentage of mothers and caregivers who know and practice home management of childhood illness to 80%. Number 5, reduce the prevalence of protein energy malnutrition among school-aged children. Number 6, increase the healthcare seeking behavior of adolescents to 50%. And services and protection objectives, ensure 90% of infants and children are provided with essential healthcare package. Number 2, increase the percentage of health facilities with available stocks of vaccines and essential drugs and micronutrients to 80%. Number 3, increase the percentage of schools implementing school-based health and nutrition programs to 80%. And number 4, increase the percentage of health facilities providing basic health services, including counseling for adolescents and youth to 70%. I need not go into letter D. You see that on the screen, which is related to AO2 008-0029 of the MNCHN and Republic Act 7875, National Health Insurance Act of 1995. Also, if you will take a look, Mr. President, is an elaboration of letter B and C of the proposed RH bill, Republic Act 9502, the Cheaper Medicine Act, Section 23, list of drugs and medicines that are subject to price regulation. There is also AO2010-0010, revised policy on micronutrient supplementation to support achievement of 2015 MDG targets to reduce under 5 and maternal deaths and address micronutrients needs of other population groups, and the Botica sa Barangay program, and the Magna Carta of Women program, the Women's Rights to Health, Section 17. Mr. President, isn't this a more elaborate version of your 2 paragraphs in the RH bill, and therefore our proposed RH bill on this salient feature first alone is already a redundancy of present laws that we have, Mr. President?
Thank you, Mr. President. In law, Mr. President, we have a legal maxim, lex specialis derogat henerdi. Mr. President, this, to illustrate, the Magna Carta is a general law. That was the first law that you presented, and the RH bill is a specific law. So if you compare the Magna Carta, where there is a declaration of women's right to health, and if you also look at the PhilHealth bill, where it also requires that we provide universal health coverage for all, these are the general laws. Now, if it would please your honor to remove the provisions on saving mothers' lives, just so that we do not repeat what is in, as he correctly pointed out, other provisions on women and children, then this would be a strange law, because a very important portion would be removed from it. So to the extent that some portions are reiterations of existing laws, I do not think that that is really cause for alarm, because otherwise, in my humble experience, there have been hundreds of laws that were sponsored on this floor, which touched on, which in fact some were exact duplications of other existing laws. So to say that this law is unnecessary simply because there are other laws that touch on a similar matter, I do not think is sufficient reason not to pass this law. But to further explain why this law is necessary, the good senator also pointed out specific administrative orders, and which is still on the screen, part of it, which are in fact very specific. The problem with administrative orders is that they are not at par with laws, and this can change from administration to administration, as we have seen during the presidency of the former president, Gloria Macapagal Arroyo. Because she was not a proponent of reproductive health, we had absolutely no policy, and her secretaries of health at that point did not really push for the strong implementation of of a few of those matters, except I have to point out Secretary Cabral, who is actually in our gallery today. But what we do not want to happen is that we have a secretary who feels strongly about this measure and then is replaced, and then the whole policy changes. And that is the reason why the details of the administrative order cannot replace whatever provisions we have in our bill on reproductive health. Two other points that I would like to mention on a situation that has manifested itself and really drives home the point of the need for this bill is the situation that occurred in the barangay where I live, Barangay Ayala Alabang. Without a governing policy on reproductive health, for that matter, a law, many local government units choose not to make available reproductive health to their constituents. Worse, in the case of Barangay Ayala Alabang, they came up with a barangay ordinance that was so restrictive so as to prevent even married couples to have access to the kind of contraceptives that they would without divulging very personal information. So, Mr. President, with due respect, I humbly submit that the necessity of this bill is made obvious by the different policies being implemented or the non-existence of reproductive policies in many local government units. And one last point I would like to make, as a sponsor, I would be very happy to accept His Honor's amendments on items which he believes are redundant or unnecessary. There is no, the door is not closed, and I'm very open to improving this bill.
Yes, Mr. President, I was just trying to save time. That's why I did not go into the, I did not elaborate on all. As a matter of fact, I have 7 more pages of the Magna Carta for Women and others just on this point alone. The number 1 point, which is save the lives of the mother and the unborn, and letter B and C of the... so, I have difficulty with accepting the fact na ito'y parang kumbaga sa ano this is a specific law for the particular... The Magna Carta for Women is a more elaborate and more specific law.
It is a general law. The Magna Cartas are naturally known to be the general laws. Because the Magna Carta speaks of many rights of women, and only one of which pertains to reproductive health rights.
Oh, nasasagian nga ho dito no? And I will go to the 6 others. I have 7 of these points that I mentioned you mentioned in your speech. So, the problem, Mr. President, is that dito sa RH Bill, you have a repealing clause. Therefore, you're repealing all these other laws that are related to...
That is a wrong interpretation.
All this, hindi po ba? Parang ganun ang kakalabasan yan.
Mr. President, may I clarify?
No, may I just...
If I may just, because that is a very important point that you raised, no? And mahirap naman pong hindi tayo nagkaintindihan sa puntong yon. The repealing clause po, very specifically says it only applies when it is inconsistent. So yung mga binanggit nyo, as far as I can see, are consistent.
Hindi lang inconsistent. Section 24.
Contrary to or inconsistent. So kung pareho po ang
Any
objective...
law, may I read it into the records?
Pwede po.
Any law, presidential decree or issuance, executive order, letter of instruction, administrative order, rule or regulation contrary to or is inconsistent with the provision of this act is hereby repealed, modified, or amended accordingly.
Yes po, and I stand by that with the bill...
This becomes the primary law. That is the effect of the repealing clause, Mr. President.
Ang ibig sabihin po niyan is yung mga batas natin that are also specific and supplement this, tuloy-tuloy po yan. Hindi ho yan naapektuhan. And by the debates that we are having now, goes into the record as well. But by all means, if His Honor believes that this repealing clause needs to be clarified further, by all means, I submit as my practice as a lawyer, that is not a confusing provision for me. But if His Honor believes that we can improve on that provision, so as not to have any misconstructions or understanding, I would be very happy to accept his amendments at the proper time.
Thank you for that, Mr. President, because in my layman's understanding, a later law prevails. I'm glad that the distinguished lady is a lawyer. There are doctor of laws that are helping the Senate, helping them, and they are probably, some of our colleagues here are well educated. This representation would probably pale to comparison as far as the background or academic background of most of the members here. But I can assure you I am a valedictorian in common sense, Mr. President. So may I offer a shortcut so that I need not read into the records all this redundancy. My shortcut, Mr. President, is why not just an implementing rules? Why don't, on the Magna Carta for Women, on the Youth and Child Welfare Code, let's just put it into an implementing rules. Lahat ng gusto laman itong RH bill, ilagay natin sa implementing rules. Wala ka ng problema. It is not a law. It shall be implemented kahit may pumalit. Then you don't offend the other sectors, Mr. President. Why don't we study that possibility?
Well, like I said, I mean, if His Honor makes a suggestion, we're always happy, but it will not prevent us from continuing with the debates, because as far as I'm concerned, there are provisions in this bill that are not covered by any other bills. But I reiterate, we can look at that. I would be very happy, and if His Honor would like to give us a written proposal on how he would like to see the wordings in the rules, what kind of budget he will put, what kind of assurances that women will have access to health care, because if all of that will be there, we will always look at it. This representation can only guarantee that I will continue to have an open mind.
Because, Mr. President, what we don't want is, I agree with the Senate President, we don't want this law to prevail over the other laws.
It will not, Mr. President, and as sponsor, I put it on record that the specific provisions identifying programs for women, programs for children, there was no intention to disregard those programs.
Senator Arroyo is recognized.
Mr. President, can we go home already? It's, you know, this bill is really difficult. It taxes the mind, it's intellectually stimulating, but very hard to understand. I think we should need a rest so that we can absorb everything, otherwise if you're tired, we cannot. I don't want to make any motion, I leave it to the majority leader.
Thank you.
No, Mr. President, I will give into that. No, but let me finish on my part one, the comparison and the redundancy on number one salient feature of the bill. Because baka akala nung records natin ay yung mga part lang na yun yung binasa ko. Mas matindi pa ho itong hindi ko binabasa eh. For example, Section 4 of the Reproductive Health Bill. Let me, bibilisan ko lang, Your Honor, para ano ha. Section 4 of the Reproductive Health Proposal. Reproductive health care. The access to a full range of methods, techniques, facilities, and services that contribute to reproductive health and well-being by preventing and solving reproductive health-related problems. It also includes sexual health, the purpose of which is the enhancement of life and personal relations. The elements of reproductive health care include 1. Maternal, infant, child health and nutrition, including breastfeeding. Number 2, family planning information and services. Number 3, prevention of abortion and management of abortion complications. Number 4, adolescent and youth reproductive health. Number 5, prevention and management of reproductive tract infections, RTIs, HIV and AIDS and other sexually transmittable infections. Number 6, elimination of violence against women. Number 7, education and counseling on sexuality and sexual health. Number 8, treatment of breast and reproductive tract cancers and other gynecological conditions and disorders. Number 9, male responsibility and participation in reproductive health. And 10, prevention and treatment of infertility and sexual dysfunction. Now, as I have read that, Section 4, Mr. President, let me read now Republic Act 9710, the Magna Carta for Women. Section 17, Women's Right to Health. Okay. Ito, batas na po ito, currently, now. And according to the Department of Health, ini-implement nila. Ito sabi, access to the following services shall be ensured. 1. Maternal care to include pre- and post-natal services to address pregnancy and infant health and nutrition. Meron pa pang didirekta dyan. Number 2, promotion of breastfeeding. Number 3, responsible, ethical, legal, safe, and effective methods of family planning. Number 4, family and state collaboration in youth, sexuality education, and health services without prejudice to the primary right and duty of parents to educate their children. Kini-question nga nila Senator Escudero ito sa RH, pero nandito na ito sa sa Magna Carta. Number 5, prevention and management of reproductive tract infections, including sexually transmitted diseases, HIV, and AIDS. It's actually a copy and paste. Hindi mo ba? Pag narinig mo. Number 6, prevention and management of reproductive tract cancers like breast and cervical cancers and other gynecological conditions and disorders. Number 7, prevention of abortion and management of pregnancy-related complications. Number 8, in cases of violence against women and children victims and survivors shall be provided with comprehensive health services that include psychosocial, therapeutic, medical, and legal interventions and assistance towards healing, recovery, and empowerment. Number 9, prevention and management of infertility and sexual dysfunction pursuant to ethical norms and medical standards. Number 10, care of the elderly women beyond their childbearing years. And number 11, management, treatment, and intervention of mental health problems of women and girls. In addition, healthy lifestyle activities are encouraged and promoted through programs and projects as strategies in the prevention of diseases. And related to this also is Republic Act 8504, the Philippine AIDS Prevention and Control Act of 1998. Again, batas na rin po ito. Hindi na pagdidebatihan ito. Ini-implement kasalukuyan ito. In the declaration of policies, it all tackles the points of the proposed bill. I really need to read this into the records, Mr. President, but I will accede to the request of Senator Arroyo. I will stop there at the moment, and with the concurrence of the distinguished lady, I will suspend. I move to suspend the interpellation and continue at the proper time, Mr. President.
Any objection? Hearing none.
Mr. President, if I may just
Senator Cayetano,
put on
please.
record, I do not object, but I will just reiterate my earlier statement that by all means the committee is very the committee welcomes proposed amendments to clarify, to make the bill more comprehensive, or to put to rest issues on duplication or even conflict. That is not a problem, Mr. President, and we do thank the Majority Floor Leader for the time that he has taken to compare the various laws that are similar to and which in many ways have common objective. Thank you.
Thank you, Senator Cayetano. Majority Floor Leader.
Can I make a manifestation before the suspension? One manifestation. Mr. President, just one manifestation before we suspend consideration today. First, I'd like to congratulate the sponsor also of this measure. I've been comparing the House version, the President version, and that of the Senate version as well. And at the very least, there are many things better in the Senate version compared to that of the House or even that of the executive proposal. But having said that, I think one of the more important provisions that is not found in the Senate version, which I agree with, is the ideal family size. Because in the version of the House and of the executive, of that of the President, it even suggests that we should only have 2 kids. And what does that mean, Mr. President? Ibig sabihin na ituturo din sa mga bata, 2 lang ang dapat ninyong anak. Ha? para sa akin, yung dalawa, kulang pa yan sa replacement rate. Because isa dyan mamatay, your population growth will go down. And you will be unsustainable as a race. So at the very least, 3. And just to put on record that today, the average Filipino size will be 3 kids. I will not put the 3.14, but it's more or less about 3 kids. Thank you, Mr. President. So congratulations to the distinguished sponsor for that.
Thank you, Senator Recto.
Thank you.
Majority
Mr. President, yes, I think we were able to dispose of Senate bill. So may I just manifest for the membership of the Select Oversight Committee on Local Government Code of 1991, Mr. President, that Senators Honasan, Trillanes, Villar, and Cayetano, Alan Peter Cayetano, be made members of the Select Oversight Committee on Local Government Code.
Any objection? Hearing none.
Also to manifest the composition of the members of the Select Oversight Committee on Government Procurement, Honasan, Marcos, Lapid, and Pia Cayetano, Mr. President.
Any objection? Hearing none.
I move that Senator Trillanes be made a member of the Congressional Oversight Committee on Dangerous Drugs, replacing Senator Zubiri.
Any objection? Hearing none.
And upon the request of Senator Bong Revilla, let's move to transfer from the primary referrals the following bills, Mr. President. House Bill 3551, House Bill 3208, House Bill 3080, House Bill 1994, House Bill 1313, House Bill 1312, House Bill 1308, and House Bill 201 from the Committee of Public Works to the Committee on Public Services, which is also chaired by Senator Revilla.
Any objection? Hearing none.
Thank you. Mr. President, with that, I move to adjourn the session until 3 o'clock tomorrow afternoon, August 23, 2004.
Any objection? Hearing none. The session is adjourned until 3 o'clock in the afternoon of Tuesday, 23 August 2011.